Chapter 15, Diet in Obesity and Underweight. So obesity, it's a chronic disease. Nobody will get obese or overweight within a day or within a week. Okay, it takes time. Okay, it takes time. And along with obesity, other chronic diseases like inflammatory responses in your body will also increase. Okay, it can begin in any time of your life. Okay, we have kids who are infants as well, infants and toddlers who are obese, children who are obese, teenagers, early adults, late adults, senior citizens. Okay, so obesity can happen anywhere and to anyone, and at any phase of your life, you can become obese. Okay, so in adults, the common symptoms are you will sweat more than usual, snoring, trouble in sleeping, shortness of breath, and in adolescents or children, acanthosis nigricans, which is your the folds of your neck, okay, and other body parts also, wherever you have folds like groin area, elbow fold, knee fold, okay, they become very dark. Okay, that is acanthosis nigricans. Sleep apnea, which means while sleeping, breathing difficulty will be there. Shortness of breath with physical activity, slightly, if you even one flight of stairs, if they're climbing, they will get shortness of breath. Okay, they will gasp for air. Stretch marks. Stretch marks can happen even in kids who are non-obese. Okay, it's not compulsory that it will happen only in obese kids. Even in non-obese kids, stretch marks can happen. Am I audible to all? Am I audible to all? Am I audible now? Is my voice clear now? Okay. So stretch marks, it can happen to anyone, any adolescent. Okay, who specifically kids who have growth spurt. Okay, even if they are not overweight, not obese, they are lean, they still can have stretch marks. Stretch marks can happen in puberty when you're specifically when children undergo growth spurt. Okay, stretch marks can happen. It's not only common to obese or overweight children. And morbid obesity, which means your body mass index, okay, your body mass index will be more than 40. Okay, so that is morbid obesity. We don't use the word morbid obesity anymore. It's class 3 obesity. Okay. Acanthosis nigricans is darkening of your skin folds. Wherever you have folded skin, naturally occurring folded skin, like your neck, your elbows, knees, groin area. Okay. Wherever skin folds happen, these areas will have dark velvety skin. Okay, it is much darker than your actual complexion. That is acanthosis nigricans. Not just in children or adolescents, this will be seen even in adults as well. Okay, so in morbid obesity or class 3 obesity, body weight is more than 100 pounds. Okay, 100 pounds more than the optimal body weight. Difficulty in breathing, difficulty in walking. One second, just give me a moment. Sorry for the break. So, coming to the etiology of obesity, etiology means the causes of obesity. So, first is genetic factor. So, genetic inheritance can influence about 50 to 70% chance if a person will be obese or not in the future. Okay. So, also within families, the chance is 80% if both the parents are obese, that the child will also tend to be obese. 50% if any one parent is obese. There is also a mutation in the human gene for B3 receptor adipose tissue, okay, which is involved in lipolysis. Lipolysis means what? Lipolysis, breakdown of fat, okay. So what happens here is lipolysis will not take place because of this mutation, genetic mutation. Lipolysis will not take place adequately. So that leads to more adiposity. What is adiposity? More fat cells within the body. So risk of obesity increases. So these are the genetic factors which can influence obesity in the next generation. Age and sex, uh, it is seen that women, okay, they tend to have higher risk of obesity as compared to men because of hormonal factors. Okay, the hormones in women will support adiposity as compared to men. The male hormones, they support, they increase the metabolism, they increase fat metabolism. Women's hormones, okay, estrogen, progesterone, they tend to keep as much as fat as possible within the female body for child rearing purposes. Okay, in any age group, you take any age group, females have higher risk of getting obese. Then eating habits, there is a list of points that they have mentioned in the textbook which could lead to obesity, like nibbling within the meals, which means that you snack in between the meals. Okay, specifically common among housewife who are tasting the food, or while cooking they eat something, and after cooking as well with the family they will have a meal. So the frequency of meal is increasing. Okay, eating faster, not chewing properly, so you will not feel satiated, you will eat much more than what is required. If you chew slowly and eat slowly, you will feel very easily, you will feel satiated with less amount of food. Okay, again, neurotransmitters and chemicals in the brain that respond to outside stimuli like sight, taste, smell, temperature, okay, they all also trigger the brain and body to eat more. Those who are fond of cooking a variety of food, those people who are working in kitchen, they also tend to become obese. Business executives as well, who attend a lot of business lunches, having more than one business lunches with clients, they also tend to become obese. Even in houses that which have children, okay, children don't finish their food. So instead of not wasting the food, the mothers or the parents will eat the leftover food. They have already had their meal, but in order not to waste the food, they will eat the leftover food. That also leads to obesity. And people who eat outside more frequently as compared to home food, people who eat more junk food, cultural practices like eating too much of sweets very frequently, not including fruits and vegetables in diet, eating highly processed food, high fat food, highly concentrated sweet food, mood eating disorders like mood related eating disorders. When you're happy, you eat more. When you're depressed, you eat more. Okay, these can also affect your risk of obesity. Refined sugars in the drinks and beverages that you have, which have zero nutrition but only calories, like carbonated drinks, sodas, cold drinks. People who have this work on rotational basis, like they have night shift, day shift, afternoon shift, what happens is that their eating pattern, their regular day-to-day schedule, that gets disrupted. So that could also lead to obesity. Then physical activity, people who definitely lead a very sedentary lifestyle, and they are having higher risk of obesity as compared to people who are active. Stress, one of the main factor of obesity is stress. Stress eating is also very common. Okay, when you're stressed, you eat more just to compensate the stimulants like endorphins and serotonin, dopamine. Sometimes you feel that food is what makes you happy because it is creating that dopamine serotonin effect. Okay, to relieve you of stress. So stress eating, when it becomes a habit, that leads to obesity. Then endocrine factors like hypothyroidism, hypogonadism, Cushing's syndrome. These are not causative agents that lead to obesity, but the risk of getting obese or overweight when you're suffering from thyroid issues is heightened. Then trauma, if you have any head injury because of which you are not able to regulate your appetite, because hypothalamus that is situated within your brain, if that gets affected during head injury, that controls your appetite and satiety. When should you feel hungry, when should you feel full? Okay, if that is affected, your eating pattern will be disrupted. You will eat more. If you don't feel satiated, you will eat more, and that would lead to obesity. Prosperity and civilization, the more civilized or more prosperous a country is, there are high chances that the people living in these countries will be obese as compared to poor countries or underdeveloping countries. Okay, so this is one of the reason we see more than half of the population in USA is suffering from overweight issues and obesity issues. Okay, it's a very prosperous country. It's a civilized country. Okay, it has a good GDP, etc. Okay, so along with that, even in Indian states, if you see the states which perform better in terms of GDP, the risk of obesity and the risk of lifestyle based diseases are also rising in these states. Okay, drugs, certain psychiatric drugs like antidepressants, steroid hormones, contraceptive, diabetic drugs, antihistamines. Okay, they all may increase your weight in individual, and also asthma medications. So these are the etiology of obesity. Is it clear to everyone? Is the etiology clear to everyone? Next, theories. Fat cell theory. There are different theories which theories are like assumptions, not proven yet, but these are the theories that uh, people tend to believe that this could lead to obesity. This is why a person is obese. Okay, so fat cell theory, it means that the number of fat cells that you will have is determined in your early life. For example, as a child, if you were overweight or obese, you will naturally have more number of fat cells as compared to kids who were lean at your age. Okay, so if you naturally have more fat cells, there are high chances that you will regain the weight that you have lost, because the fat cells don't disappear easily. Fat cells, they don't disappear easily. Once you have developed naturally, when you have developed more fat cells as compared to your peers, okay, even if you lose your weight, it is very easy for you to regain the lost weight because you naturally have more fat cells which can accommodate more fat in the future. Even if you go do slightly you slightly go overboard with your eating habits, it's very easy for you to put on weight if you were a fat child or you were an obese child. So the total number of fat cells is always set early in life, supporting the notion that if you have juvenile onset obesity, that will lead to the increased number of fat cells. And even when you are adult, okay, the number of fat cells will not increase. But since fat adipose cells have this property that they can stretch as much as possible, okay, they can accommodate as much as fat as possible. So when you naturally have higher number of fat cells, accommodate as much as of fat as possible, okay, which increases your risk of obesity even in adulthood. More fat cells, which means you will eat more, there will be more space for fat to be deposited in the body. So that is fat cell theory. Then we have a set point theory. Set point, from the name it suggests that everyone has a biological weight that is set for them. Okay, every and your metabolism will adjust to the set point. Okay, for example, just imagine your biological set point is around 60 kg. Okay, so automatically when you eat more, when you have put on a little bit more weight, like let's say you became within 2 months you became 63 kg. Okay, your body metabolism will increase slightly, okay, to reduce that extra 3 kilos. Okay, and if you have reduced extra 3 kilos, you have become 57 kg from 60 kg, your metabolism will automatically slow down that, so that you don't lose much more weight. Okay, so body naturally has an inbuilt system to identify, are you eating more or are you eating less, and how should it adjust the basal metabolic rate. Okay, but you can change this biological set point. Once the body weight reaches a point, the whole set of signals that is produced, that influences the person's food intake, okay, that will change as well. Okay, for example, since the past 5 years, your biological set point was around 60 kg. Within the past 1 year, you have gained so much of weight, around 7 to 8 kgs you have gained. Now your set point has shifted to 67 kg. Okay, it will become difficult for you to go below 67, even after you diet or whatever you do to lose the weight. It is difficult for you to go back to the same set point which you were earlier. Okay, so this is the set point theory. Then we have hunger versus appetite. This theory is not mentioned in the textbook, it's just that for your knowledge. Hunger is different as compared to appetite. Hunger is physiological. You feel hungry because your body requires nutrition. Okay, that is the reason why you feel hungry. But appetite is psychological. Even if you're feeling hungry, even if your stomach is making noises, you are hungry, you know that you are hungry, but you do not have the mood to eat. You do not have the you do not have the feeling to eat something. Okay, so that is appetite, that is psychological. Hunger is physiological. Every being in this world goes through hunger. Okay, animals, humans, everyone goes through a hunger. Appetite is more psychological. Appetite is, even if you're hungry, do you want to eat? Okay, hunger is the need, appetite is your want. Okay, do you want to eat, do you do not want to eat? That is appetite. Hunger is the need, it's the need to survive. Okay, set point can change for everyone. If you are in a particular weight for a long period of time, that new weight becomes your new set point. Okay, basically set point theory means every human being has a set point weight. Okay, and your metabolism will adjust so that you stay in that set point weight. If your weight is slightly increasing a bit, your metabolism will also increase, so that it can bring you back to the set point. Okay, even if you're losing a lot, 3 to 4 kg, suddenly your body metabolism will go down so that you don't waste more weight. Okay, so that is set point theory. Okay, your basal metabolism is trying to bring you back to a point from where you have started. But set points can shift as well. Okay, if you have been in a specific new weight for a long period of time, this new weight becomes your new set point. It depends, it's very subjective, it depends. Okay, since how long have you put on the weight? If it is a sudden weight gain, it won't affect much. But if you are in a new weight, you have increased your weight up to, let's say, 7 or 8 kg increase is there in your weight, and you have been in this new weight for the past 6 months. Okay, you're finding it difficult to reduce this weight. It means that you have created a new set point. Is the theory is clear to all? Next is the role of hormones. Four main hormones you have to study in this. Don't read or don't try to by heart the entire paragraphs that are given on page number 292. Just focus on the table, table 15.1 on page number 293. Those who have the textbook, that's more than enough. Okay. So, insulin. So 80% of obese patients have hyperinsulinemia, which means they are already suffering from insulin resistance. If there is too much of insulin in your body, in your bloodstream, means you're suffering from hyperinsulinemia. Too much insulin in the blood means your cells are not responding to insulin. Pancreas are creating insulin. Okay, pancreas are making insulin, but the cells are not responding to it. So what can insulin do? It has to stay back in the blood and raise the blood insulin levels. Okay, so majority of the obese patients, obese people, they already have high insulin in their blood, and they also suffer from insulin resistance. So how do you shift this to lose weight? Okay, for obese patients to lose weight, they have to make sure that their cells are responding to insulin. Okay, the cells become sensitive to insulin so that it starts responding to it. It starts taking up the glucose from the blood and convert it into energy. Then thyroid hormone, as we all know, it is associated with your metabolism. Okay, if the serum thyroxine levels are usually normal in obese patients, but those who have hyperthyroidism or hypothyroidism, they have thyroid hormones, but the cells are again not responding to the thyroid hormones. Very similar to what happens to insulin. Okay, insulin is produced, but cells are not responding. Even the hypothyroidism, okay, uh, insulin is either hormone is produced less, cells are not responding to it. There are very less cell receptors that can respond to thyroid hormones. This is a common theme that we have seen in obese patients. Then growth hormone reduces with obesity. If you increase your growth hormone secretion, you will develop more lean muscle and you will naturally increase your basal metabolic rate. Okay, when growth hormone secretion increases, your basal metabolic rate also increases. Then you have leptin. Leptin is it's a hormone that is supposed to make you feel satiated. Okay, so those who have high amount of leptin hormone or leptin resistance, that is seen in obese patients. Okay, so leptin hormone, it actually makes you feel hungry. Renin is the hormone that makes you feel satiated. Leptin is the hormone that makes you feel hungry. Ghrelin is the hormone that makes you feel satiated. Just give me one minute. These hormones are secreted when your blood glucose levels go down naturally. Okay, when the blood glucose levels are going down, leptin has to be secreted so that you feel hungry and you eat more so that the blood glucose levels come up. Coming to the assessment, okay, You can take the screenshot of this. The weight given here is not in kilograms, it's given in pounds. Okay. Height is given pink column and um, blue column. These are height. Blue is for males, pink columns is for the females. And compared to whatever column you belong to, what should be your weight in pounds they have given. Okay, this is not in kilograms. You can convert this into kilograms. Women at different age, what should be the target weight, upper limit and lower limit. You can use Google for this, converting pound into kilograms. Whatever number is given, if you can just Google for use Google for that. 1 pound is usually it is equal to 0.45 kilograms. 2.20 pound is equals to 1 kg. 2.2046 pound is equal to 1 kg. This is the BMI chart. For example, how to use this, I'll give you, let's say a person whose height is 175. Okay, a person whose height is 175 and their weight is 65. Okay, 65.9. Both are given on the row side and the column side. If you see above, you will find different weight category, and if you see here this side, you will find different height category. Okay, 175.2 is the height and 65.9 is the weight. Okay, so based on this, if 65 is the weight and 175 is their height, will they come under healthy BMI, underweight or overweight? Just by looking at the column, you can identify this. What do you think? Is it? No, it's not a target. I'm just giving you the height and the weight. Okay. And just by looking at this table, even without doing the calculation, can you identify is it a healthy weight or is it a unhealthy weight? If you understand the table, you will be able to use this. You can answer the chat box. What do you think is this category? It's a healthy category. Okay. So now you know how to use this entire table. Yeah, if you go more than 65 kg for this person who has 175 centimeter as a height, if you go more than 65 kg, okay, you are going towards obesity. Is it clear to everyone how to use this particular table? Even without doing the calculation is very easy to find out BMI. But if you have a person's height and weight, even though if the weight is in kilograms or pounds, they have given both in kilograms and pound, in inches and centimeters, both have been given. Okay. It's very easy to find out the BMI even without doing the entire calculation. Next criteria of assessment is your waist circumference. Waist circumference means everyone would wear a jeans or a trouser, you know your waist, okay, 30-inch waist or 32, 34, okay. So based on that, it's a for females and males, it's a different category. So what is the risk category here? Risk for cardiovascular diseases. Okay, risk for lifestyle diseases, cardiovascular diseases, diabetes, cholesterol. Okay, these are the risk category. Okay, so females who have a waist that is less than 27.5, you get a jeans and your jeans waist is less than 27.5, your risk category to get cardiovascular disease is very low. Okay, in males, men who have waist that is less than 31.5 inch, okay, your jeans or trouser size is less than, waist is less than 31.5 inch, your risk category is also quite low to get cardiovascular diseases. And any female whose jean size or waist size is between 27.5 to 35, up to 35 waist inch is completely fine with females. You will still have a low risk category. For men, 31 to 39 inches, okay, low risk. If females cross 35 in jean size, okay, their risk increases. In men, if you cross 39-inch on the waist size, your risk for cardiovascular diseases, diabetes increases. Very high is above 43-inch, and in men it is above 47-inch. Is it clear? So it's a very simple system of understanding in which risk you come. Okay, and everyone knows this detail. Everyone knows their own waist size. No, height does not affect the system, because we'll come to that later, why waist size is important to understand the risk of cardiovascular diseases. Then this is the DEXA chart. If you want to measure your body fat percentage, okay, The most ideal way to identify it is using a DEXA scanner. Dual energy X-ray absorptiometry, DEXA scanner. Okay. I have mentioned the name of the scan in the chat box. DEXA scan, dual energy X-ray absorptiometry. Okay. So a person's front and back both is taken and the both is scanned using DEXA. Okay, in which you can see here the blue, the dark blue and blue, light blue part. These are the dense part in the body, which means it is the bones. Okay, the red to yellow part, red part will come, red and pink part will come under the muscle category. Okay, muscles category. Orange to yellow is the fat part, how much fat is there. Okay, so this is how the DEXA scan looks like. So the computer will calculate what is the surface area covered by these different colors. Okay, so wherever the yellow and orange colors are present, it means more fat is stored in these areas. Okay, and approximate fat percentage will also be found out through using DEXA scan, because this is one thing which is a disadvantage when you use BMI. Okay, two people can have the same BMI. Okay, two-person who has the same height and same weight, their BMI is going to be same. But what is their body fat percentage? What is their muscle percentage? What is the bone density? It could be completely different. Okay, we cannot understand that. Athlete and one athlete and an overweight person, they may have the same weight and same height, but the body fat composition of an athlete and a overweight person would be completely different. Okay, so to identify that, we have these scanning systems. Okay, this is called a DEXA scan. Yeah, some different underwater weighing machine, weighing system is there. There are different systems through which you can find the fat percentage. Around six different systems are there, but DEXA is the most convenient one. Okay, whichever hospital has a DEXA scanner, you can just go there and get a DEXA scan for yourself. Underwater weighing techniques and all that, these are used only in sports complexes. Then we have the ponderal index. Again, in ponderal index, they use the ratio of height and the cube root to of weight, and a formula is given in the textbook as well as here. Okay, here the height is given in centimeter. In the textbook, they have given the height in inches. Weight is given in pound. Here the weight is given in grams. You can use Google as well for finding the ponderal index. Okay, you can do it right now if you can, if you have your mobiles with you. You can use Google. You can put search for ponderal index calculator. Put your height and weight. You will get some pages. Okay, we choose any page, any website. Have you got your answers? those who have got your answer less than 13, okay, if your answer is less than 13, if your calculated answer is less than 13, which means you come under the obesity category. If your answer is more than 13, okay, either you are overweight or you are normal, okay. The higher the number of ponderal index is, if it is more than 15, or if it is more than 16, it means you are healthy, okay. If it is between 13 and 16, it means you are overweight. If it is less than 13, it means you are obese, okay. So coming to your waist to hip ratio, okay, so this is where different body shapes come into account, okay. Body shapes like apple, pear, uh, avocado, different types of body shapes are there. It is found both in men and women. It's not that only women will have the pear shape or avocado shape, but men can also have pear and avocado shape. Women can also have apple shape. Okay. Ponderal index, if it is less than 13, if your answer is less than 13, 1 3, it means the person is obese. You can choose, as a dietitian, you can choose whichever formula you are comfortable with. You can choose to have a knowledge of all these formula is better. You can choose which formula is uh, you're comfortable with. So if your waist to hip ratio, okay, waist to hip ratio means numerator will be waist, denominator will be the hip, okay. You can calculate this in inches or centimeter, whatever, okay. So if you're taking in centimeter, both the weight and the hip, sorry, waist and hip, both should be in centimeter. If you are taking it in inches, both the waist and hip should be in inches. Okay. So whatever answer you get in women, okay, if your answer is 0.85 or higher, it means you have a higher risk of cardiovascular diseases. In men, if your answer is more than 1, okay, your waist to hip ratio answer is more than 1, you have high chance of cardiovascular diseases. Basically, if you have a pot belly, hip should be the denominator, waist is the numerator. Okay. For example, let's say your waist is 32 inch, your hip is 39 inch. Okay. So 32 divided by 39. Whatever answer you get, see in this chart. First, you check the sex of the person as well, male or female. Okay. Waist in inches divided by hips in inches or centimeter. Okay, waist in centimeter will also do. But both numerator and denominator should have the same units of measurement. Okay. Physically, see, waist is where your trouser, it's not low waist or high waist, it's a mid waist just below your navel. Just below your navel is your waist. Okay, not above or on the navel, just below. Okay, at least 1 inch or 1.5 inch below your navel is your waist, where your trousers sit comfortably. That is your waist. Okay. Your hip is the most the peakest point of your hip. You have to bring it to your pelvic point. Okay, using a measuring tape. Just the way how tailors measure your hip, the same way you have to measure your hip size. From the highest peak of your buttocks till the suprapubic bone. Okay, that is how you select the you measure your hip size. Then you have Broca index. It's very easy to identify the Broca index. Just subtract 100 from your height. That's your ideal weight. Okay, ideal body weight is subtract 100 from your height. This is what they have given in the textbook, but on screen you will see a slightly different formula. Height in centimeters minus 100 is for men, but height in centimeters minus 105 is for women. Okay, but in textbook they have just given one formula which applies to both the genders. You can choose any one. Okay, both will work fine, but to be more accurate, it's better to have two different formulas for men and women, because there is a difference in metabolic rate and body fat composition as well. So these are the assessments. All these formulas and ratios which we have seen so far, this will help you to assess, is your client overweight, obese, healthy, undernourished? Okay, just to categorize your client, all these formulas can help you. Okay, you can use all these formulas on the same client as well, just to get a very objective answer. Okay, you can use all these formulas and see, we have discussed almost 5 different assessment. You can use all these 5 different assessment and see what is the average answer. Okay, all these assessments, to which side are they leaning towards? Are they leaning towards overweight, obese, or healthy? Okay, if you're not satisfied with one form of assessment, use all these different forms of assessment. So obesity, to when we do the obesity categorization, BMI is used. Okay, grade 1 obesity or obesity class 1, if you have a body mass index above 30, we call it obese. Obesity class 1 is about 30 to 34.9. And on their own also they can reduce this obesity by doing their regular diet. They can reduce the obesity. Obesity class 2 onwards, you will require medical help. Okay, 30 to 39.9 is obesity class 2. Slightly different rates they have given in the textbook. In grade 2 obesity also, shortness in breath, reduced capacity of the circulatory system, respiratory system, fat in the muscle mass as well, hypertension, atherosclerosis, risk of diabetes, fatty liver, gallbladder diseases, osteoarthritis, hernia, varicose vein. Even mortality rate also increases from obesity class 2. Obesity class 3 onwards, body mass index is above 40. It is morbid obesity or obesity class 3, third grade 3 obesity. In this, even the day-to-day activities the patients are not able to do. They're dependent on someone else, caretakers, and they will require surgical measures to reduce their obesity. Okay, in obesity class 2 and class 3, medical help is required to lose weight. Coming to the regional distribution of adipose tissue, you have two main categories: android fat deposition and gynoid fat deposition. Means apple shaped body, pear shaped body. Okay, so it depends on your metabolic rate, hormones that you produce. Okay, how is the nutrients getting metabolized or broken down in your system? What is the natural fat deposition in your body? Do you have more white, brown, or pink adipose tissue? Pink adipose tissue is only found in women, not in men. Pink adipose tissue is the fat cell that is usually deposited around the hips and thighs of the females, okay, which will be used during pregnancy and lactation for supporting the child's nutrition. Okay, that is the pink adipose tissue. White and brown is found in everyone. Okay, brown adipose tissue produces insulation, it traps the heat, it gives heat to the body. White adipose tissue mainly stores fat. Okay, women generally have more white adipose tissue, men have more brown adipose tissue. Okay, so weight gain when it happens above waist, okay, whenever you put on weight, everyone is different, okay. So people when they put on weight, everyone puts on weight in a different manner. So if you when you gain weight above your waist, okay, first whenever you put on weight, this it's your stomach or upper body part which is showing the weight, that is more harmful than the weight gain around the hips and flank area or the pelvic area. And generally, Indians have higher abdominal fat as compared to other ethnicities. Visceral fat is also high in Indians. Visceral fat means the fat that covers your internal organ. Okay, every organ has a cushion of fat covering them so that it can be protected from blunt trauma. Okay, so too much of visceral fat is highly unhealthy. It leads to cardiovascular diseases, lifestyle diseases, risk of diabetes, cholesterol increases with high amount of visceral fat. So android, it is associated with greater risk of hypertension, insulin resistance, diabetes, dyslipidemia. Dyslipidemia means high amount of abnormal levels of lipids in your blood. Fat in your blood is abnormal. Okay. Coronary heart diseases, gynoid type of body type, that is pear-shaped body type. It is not worrisome health wise, okay, and commonly found in females. Men also have, some men also have gynoid kind of body type. Here the fat deposits are usually uh, used up for pregnancy, demands of pregnancy and lactation, so it does not have ill effects on health. Pear shaped bodies. Then we have juvenile onset obesity. It develops in infancy or childhood. From early childhood, children who are obese, increase in the number of adipose cells. Adipose cells have a long lifespan and need to store fat. It makes it difficult to lose weight even once they become adults. Losing weight is difficult for kids who were obese since childhood. Causes poor dietary pattern, lack of physical activity. 43% of adults watch at least 2 hours or more of TV or per day. Today, nowadays, it is smartphone, use of smartphones, not getting physical activity, not going out and playing. These all are another causes of juvenile onset obesity. Also, kids who were bottle fed more than breastfed, they also have higher risk of developing obesity. Children who are born through C-section, okay, they also have higher risk of being obese in later life as compared to kids who are born through normal vaginal delivery. Am I audible now? Cesarean section, the reason being, kids who are born through normal delivery, while they are they are coming out of the vaginal canal, okay, while they are being delivered, they also ingest the bacteria which is found in the mother's vaginal canal, okay. So these bacteria help them to have better digestion. Okay, they will start off with better digestion and metabolism as compared to kids who are born in C-section. Kids who are born in C-section, they do not have the chance of having or ingesting the yeast and the bacteria found in the natural vaginal canal. Okay, so that does not support them with healthy onset of digestion. Okay, it just depends on how the child's own metabolism and digestion starts when they start to breathe on their own outside the mother's body. Adult onset obesity develops in adulthood. They have fewer number of adipose cells because they may be a very lean kid when they were young, so they do not have much more number of adipose cells. They have fewer number of adipose cells, but cells in general, it has a tendency to get larger and larger and store as much as fat as possible. Okay, if weight gain continues, the number of adipose cells can also increase. Okay, if the adult is not able to control their overweight issues or obesity issues with proper diet and physical activity, along with the size of the adipose cells, the number of adipose cells can also increase. Okay, but this increase will take place in early childhood. If the child is obese, the number of adipose cells increasing, that can happen in childhood if the child is obese. It can happen in a late adulthood as well if you're not controlling the weight. Now coming to the strategies of weight loss, treatment strategies of weight loss: diet therapy, physical therapy, stress management, pharmacotherapy, behavior therapy. Okay, these are the different therapies available for uh, weight management. Diet therapy is what we will discuss in detail. Physical activity, also different types of physical activity. We'll just go through it. Okay. Stress management, pharmacotherapy, and behavior therapy. We will not dwell much into it because that comes into the medical management. It comes into a clinical management as well. Okay. Stress management, we can still give some counseling on that. But pharmacotherapy, using medications, specific medications, supplements to combat weight loss, it should be used only under prescription. Behavior therapy, it should be given only by a counselor or a psychiatrist or a psychologist. Okay. So these two areas we will not discuss much because you will have to be a practitioner or in any of these fields to study this and practice this. But diet therapy, physical activity, and some aspects of stress management, we all can guide others with. Weight loss surgery as well, it's completely a clinical process, surgical process. You should only be aware of different weight loss surgeries available. Okay, but you're not supposed to guide others with this because it's a duty of the clinician, of a doctor, to identify, is this person or a patient, will they categorize, will they, are they checking all the boxes to undergo a bariatric surgery. Okay. So coming to diet therapy, low calorie diet, less than 800 kilocalories in general, but again this is very subjective based on the person's height, weight, metabolism. We have a formula for that, we will discuss that in detail. Okay, so based on somebody's height, weight, and metabolism, calorie is counted, but generally staying below 1000 kilocalories or 800 kilocalories helps in weight loss. Even 400 to 800 kilocalories can be used safely in extremely obese individuals, specifically who have undergone bariatric surgery and who are on special diets. After undergoing bariatric surgery, you cannot eat like a regular person. Okay, you will be given specific formulas to take. Okay, so that formulas will come under the category of this 400 to 800 kilocalories. And if you are under this category of having only 800 kilocalories per day, you will require an assistance of a physician and a registered dietitian as well to carry out this diet. Then reducing the diet, the main goal of weight loss therapy is to reduce the body weight, but more than doing physical activity, 80% of your body weight can be reduced just by altering your diet. Okay, the remaining 20% of the reduction can be achieved through exercise, okay, and other physical activity. Usually in the first month you have to target less, maximum 3 kg should be lost in first month. 500, even if you are losing 500 grams on a day, on a weekly basis, 1 week you lost only 500 grams, that is completely fine. Okay. Then energy deficit calculation, we'll do this calculation so that you will understand how to use this. Energy deficit calculation means energy deficit, you are taking away the calories from their regular diet so that they can come back to their ideal body weight. This is energy deficit calculation. Okay, we use the regular body basal metabolic BMR formula, and in that we will reduce the total calorie. At least 300 to 500 kilocalories will be reduced from the regular calorie intake. Okay, so that we can put the patient into an energy deficit kind of situation where they are eating less calorie but burning more calories. Okay, that is energy deficit. Okay, you're taking in less calorie but burning more. This is energy deficit. Okay, so we'll do a calculation here right now so that if you have a paper, pen or pencil, it will be ideal. So step by step follow this. Okay, before doing this, please take care of body mass. Please understand what is board mass. Board mass is the series of how you will use different operations. Okay, so when I give you a formula, okay, if the formula has these brackets, you can see here the formula, it has brackets. First solve what is there inside the bracket separately. Okay, this one bracket you have to solve separately, second bracket solve it separately, third bracket solve it separately. First work out the bracket, then the orders like square root, cube root, okay, square. This formula does not have any squares or cube root, don't have to worry about it. Division, again, this formula does not have division. Multiplication is there, but it is within the bracket, so you have already done it. Okay, addition is there. After solving the bracket, you add what has to be added, and finally you will do the subtraction. That is, you have to subtract this last two part. Okay, this is a BMR that the formula they have given is for women. BMR formula for women, it is slightly different for men. You can check on page number 301 and mention what is the only aspect that is different in a man's BMR. You can put it in the chat box, what is the difference that you find in both the BMR. Yeah, in man's formula, at the end it is +5. In a woman's formula, it is minus 61, 161. That is the only difference. Remaining everything says the same, okay? 10 into weight in kilograms plus 6.5 into height in centimeters minus 5 into age in years. Minus 61 for women, plus 5 for men. That is the only difference, okay, to calculate the basal metabolic rate. So the first step is you have to identify your client's basal metabolic rate. Okay, so first we will do for woman. Okay, her weight is 69 kg, height is 163, centimeter. Age is 29 years. Okay. Lifestyle is sedentary. The reason why you will use lifestyle, I will explain that in step 2. But first calculate the step 1. Okay. Do this calculation using your calculators and put the answer in the chat box only for step 1. The correct answer I will put in the chat box. First write down who all have got the answer. You can include the decimals or you can exclude the decimals, that's fine. We're calculating calories, so decimals, you can work it out. Yes, the answer is 1402.75. 1402 is also fine. 1403 is also fine. 1402.75 is the correct answer. If you have got any other answer, it means you have not followed the board mass. Okay. The order of operations. So please correct that. Okay. Coming to second step. Okay. Now you have identified the basal metabolic rate of this person. Okay. This woman's basal metabolic rate is understood. Okay. Now I have mentioned the lifestyle was sedentary. So what will you choose here? Which number will you choose here from step 2? Yeah, 1.2. Okay, 1.2 is the physical activity level. Okay, physical activity level is 1.2 because this person has a very sedentary lifestyle. Now, step 3, you multiply BMR and activity level. Means the answer that you got here, 1402.75, 1402.75 multiplied by 1.2. What will you get? The answer is 1683.3 kilocalories. 1683.3 kilocalories. Okay. This was step 3. Okay. Step 4 is you have to subtract 300 to 500 kilocalories from this answer so that you put the person in calorie deficit. Because if this person continues to eat 1683 kilocalories on a daily basis, they will not lose weight, they will not gain weight. They will stay in that particular weight range. That is, they will stay 69 kg for a longer period of time. This is the weight maintenance weight. Okay, weight maintenance calorie is this for this person. Weight maintenance calorie will be 1683.3. But you here the goal is putting this person into a calorie deficit mode. That is in a weight loss mode. Okay, so you have to reduce 300 to 500 kilocalories. So you start with reducing 300 kilocalories. Start with that. Okay, so it will be 1382 kilocalories. You will start with that for first week. By second week, you can subtract more calories. You can put them into 400 kilocalories minus. Okay. And then by the end of 1 month, you can completely reduce 500 kilocalories from that diet. Slowly, you can do this. Okay. So this is how you do the calculation of putting someone into a weight loss category. Okay. Is it clear to all? Second step, you just have to identify what is your client's activity level. If they have a sedentary lifestyle, you have to choose 1.2. If they have they exercise at least 3 times a week, 1.375. Moderate level activity, they are on at least 5 days a week they are exercising, 1.5. If they are working out quite heavily, 1.7. Okay, this is the physical activity level. That's So something same you have to work out with a man's formula as well. If we are dealing with a male client, okay, we can change the formula into BMR of a man's formula, and you can work out the same steps. Things you have to identify here is you should know the weight, height, age, and the activity level of your client. If it is weight gain, you have to add more 500 kilocalories. Whatever answer you got in step 3, you multiplied step 2 with step 1, you identified the BMR, you multiplied it with activity level, you got the basic calories what they are taking on a daily basis. But if it is weight gain, instead of subtracting the calories, you have to add 500 kilocalories. That will lead to weight gain. Is it clear to all? So this is the formula that you have to use for weight loss and as well as weight gain. And if the client says, I am happy with my weight, I'm completely fine, I just want to maintain this weight, you just have to stop at step 3. Is it clear to all? So you can use this formula for your family members as well. And you can give them dietary guidelines regarding the same topic. Whatever their goal is, if it is weight gain, weight loss, whatever the goal is, okay. So principles for weight loss: 20 kilocalories per kg body weight. For example, the same client, if I'm giving you the same client who had 69 kg weight, okay, if you multiply by 20, because 20 kilocalories per kg body weight, 69 multiplied by 20, how much did you get? How much is the answer that you found? 69 multiplied by 20, 1380. And when you use the formula, when you use the entire formula, something very similar you got, right? It was around 1383, something like that was the answer. If you reduce 500 kilocalories, it will be 1,183. If you reduce only 300 kilocalories, it was 1383. Okay, so something very similar you got just by multiplying 20 kilocalories per kg body weight. Okay, so if you do not want to work out such a long formula, okay, you do not want to like get messed up with the order of operations and all. Okay, you can use the simple formula: 20 kilocalories per kg body weight. Continue this. And what if after 1 month, let's say, this person's body weight reduced, this woman's body weight reduced to 65. Okay, she lost 4 kgs in 1 month. It reduced to 65. Again, you will multiply it with 20. 65 into 20. Whatever is the new weight, you have to multiply, you have to keep multiplying that with 20. That will be your new calories that you have to maintain. Okay, so 0.8 to 1 gram of protein per kg body weight you have to eat, so that you have a good weight loss, but you do not lose your muscle mass. Complex carbohydrates should be more in your diet, like millets, oats, muesli, or sprouts. Okay, complex carbohydrates should be more, and low glycemic index food also should be more. Use skimmed milk. Don't use completely toned milk. Make sure you don't take any trans fat or saturated fat. Okay, take vitamin A and vitamin D supplementation, specifically if your calories are going to be less than 1500, or if it is going to be less than 1000 kilocalories per day. Please take supplementations. Limit your dairy to limit the calcium. You have to restrict your salt as well. Salt restriction should also be followed. Calcium sometimes may depress certain hormones that helps the body's ability to break down the fat. So to limit calcium a little bit is good. So reduce your dairy intake. Glass of warm water before meals will help you to feel satiated with less amount of food. Small portions of food can also make you feel satiated. If you have a glass of warm water before your meals, add more fiber into your diet, high fiber diet. And pharmacological drugs like sibutramine and orlistat are used for weight loss, but only under physician's prescription. Otherwise, do not use these drugs. So these are general principles for weight loss. Other dietary guidelines they have given on page number 304 onwards, that you have to do self study. Please read these page numbers: 304, 305. All are points, simple points. Once you read it, you will understand the concept. It will give you more information, more facts about weight loss. And barriers of physical activity, weight maintenance. These things you have to do a self study, read it on your own. If you have any queries, you can reach out to me. But once you read this, you will understand the concept. You do not have to take classes on it. It's very simple concept here. Something that you already know about weight loss. It's again given. It is given in repetition in the textbook. That's it. Gastric bypass surgery. So this is how you remove the fundus of the stomach up till the antrum. Okay, and directly you connect the you connect the cut down portion directly to the duodenum. Okay, you take the duodenum and stick it to the jejunum. Jejunum part is directly it will be directly added into the end of the esophagus. A small gastric pouch is left. Okay, remaining gastric part is completely removed. This is one type of gastric bypass surgery. So you are bypassing the entire duodenum. Pancreatic juices and other bile juices will still come here, and it will get mixed up into in the jejunum part. Here the bypass you're creating is you're not allowing the food to go through the stomach completely and to the duodenum. You are putting it directly into the jejunum part of the intestine. So this is the gastric bypass surgery. It is done only in morbid obesity cases, in extremely obese cases. Coming to complications of obesity, physical activity, since the body has to carry extra load, you will have complications like arthritis. Your joints will have more weight to bear. So, joint pain, hip pain, arthritis in joints, knee joints, hip joints, lumbar spine. Okay, you will suffer from flat feet. So, these are the physical disabilities that comes with obesity. Adipose tissues around the chest and diaphragm will not allow you to breathe properly or breathe with lungs completely filled with air. That is not possible. So breathlessness will be there. Metabolic disorders like chronic inflammatory conditions it can lead to cardiovascular diseases, Alzheimer's, diabetes, immune dysfunction, arthritis, hyperinsulinemia, too much of insulin in your blood, high hyperlipidemia, too much cholesterol in the blood, lipids in the blood, gout. Okay, cardiovascular diseases apart from atherosclerosis, people who have high BMI, they can have high blood pressure as well and increased risk of varicose veins. Sleep apnea, it means you're not able to breathe properly while you're sleeping. Okay, or while lying down, you're not able to breathe properly. That is sleep apnea. You have to sleep in a cardiac position, which means your head and neck is slightly elevated and upper part of your chest is slightly elevated. Only then you can breathe properly while sleeping. It's usually not brought back to normal because prone to accidents, clumsiness, falling down slippery, okay, or while crossing streets, there are high chances that you may fall down, tumble down. Gastrointestinal disturbances like esophageal reflux diseases, whatever you eat, it is coming up about the esophagus causing acidity, hernia, erosion of the esophageal linings, high cholesterol in bile, fatty liver, risk of forming gallstones, then osteoarthritis. Weight bearing joints also have very common complication of obesity in middle aged women. Then obstetrical risk, obese women who are pregnant, they have high risk pregnancy, high risk of getting a PIH, pregnancy induced hypertension, GD, gestational diabetes, postpartum infection, restriction of weight gain during pregnancy, increased risk of having neural tube defects in the child like cleft lip, cleft palate, spina bifida. Infertility is also increased in obese women, risk of infertility. And psychological disturbances like having eating disorders or depression, self blame, not participating in social events, low life expectancy because with the risk of so many lifestyle disorders, life expectancy also comes down. Cancer, colon cancer, rectal cancer in men, uterus cancer, breast cancer in women, biliary tract cancer, gall cancer in women who are obese. Endometrial cancer and obesity also has a correlation, association between endometrial cancer and obesity in women. So weight management guidelines for dietitian. First, what you have to do when you get a client who wants to lose weight, first use the assessment techniques that we have discussed, like body mass index, proca index. Okay, what is their eating pattern, what are the food choices, are they vegetarian, non-vegetarian, vegan, okay, how much physical activity do they have, what is their weight management history, okay, do they have these cycles of weight gain and weight loss, or since childhood, if they were an obese child or overweight child. You have to get all this history first, determine all these facts first, then decide, do they require a short term care or long term care. Okay, some clients within just 6 months of diet plan or 4 months of diet plan, they can achieve their ideal weight. Okay, they may be just overweight, they are not obese, they are just overweight, so short term plan is okay for them. For obese patients, long term plan is required. Okay, because even after they lose weight, there are high chances that they can gain all the weight they have lost. Okay, so for that case, you will require a long term care so that they don't gain back the weight they have lost. Okay, so you have to decide what kind of care you have to give them, short term or long term. Then apply the food choice strategies which we have discussed: low glycemic index food, low glycemic load food, complex carbohydrates, low fat, high protein. Okay, these are the food choices you have to apply. More fiber, no saturated fat, no trans fat. Okay, whole grains, more fruits, vegetables, etc. And practice internal regulation. Whenever the patient or the client is feeling like they want to eat more, help them to munch more on snacks like apples or nuts, berries, okay, fruits, vegetables, cucumbers, instead of going and buying a package of Lay's chips, etc. Hunger recognition, identify hunger and appetite, okay. Enjoy physical activity, make the physical activity enjoyable for them, whatever they like to do, like dancing, running, what, it's very subjective, yoga, whatever is that they like, encourage them to do that. And monitor the consistent professional support, food records, make sure that they maintain a food diary, because having a food diary helps them to identify that pattern of eating when they are overeating, how to identify it, because when they see the list of items that they have actually eaten, when you eat things without noting it down, you will never know how much you are eating. But when you start writing it down, you take the efforts and write down each and everything that you have eaten throughout the day. At the end of the day, when you see, you will identify where and all you have munched without uh, recognizing it. Okay, so from next day onwards, you will be more conscious about eating or snacking on other things. So that's how food recording and food diary helps you. Weight expectations, set realistic weight expectations. Don't give high hopes for the patients to or clients to reduce 10 kg in 1 month. Okay, these things are possible, but it's not healthy. Okay, reducing at least 2 to 3 kgs on a monthly basis is completely normal. Even if it is slow, it is healthy. Okay, quality of life should also be good with weight loss strategies. Coming to underweight, people who are underweight, this would be their BMI, usually below 18 is underweight, severely underweight below 16 if the BMI is below 16, moderate underweight 16 to 16.99, mild underweight 17 to 18. Normal range, it is 18.5 to 24.99. Limitations of people who are underweight: reduced VO2, that is oxygen capacity. Underweight pregnancy is more risky. Work off due to illness, more than obese patients. It's seen that people who take off from leaves from work because of sickness or illness, it's seen that it is more common among underweight employees as compared to obese employees. Increased mortality because of micronutrient deficiencies, immunological defect, okay, not having enough amount of micronutrients, that would also lead to immunological defects. Delayed menarche in girls who are underweight since childhood, they will not get their periods on time. It will be after the age of 16 or 17, that is delayed menarche. Other prevention strategies, etc., are given in tables. You can go through the tables. Thermogenic foods, some recipes, prevention of obesity and overweight in different age groups. It's given on tables. You can read that. Don't need to read the paragraphs, just go through the tables. It will give you some simple insights. That's it. And nutritional and food requirements for people who are underweight. Whatever is their current calorie intake, add more 500 kilocalories into it. Okay. Calculate the BMR formula, do the steps we have discussed earlier. Okay. Add 500 at the end of the step. That would be their target calories that they have to meet on a daily basis. 1.2 gram of protein per kg body weight, higher intake than as compared to obese or overweight clients. Fatty foods should be taken in the beginning of the meal, and then you can go into the protein food or carbohydrated food. Be liberal with carbs as much as possible, but complex carbs. Okay. Do not take any fluids before meals. Avoid taking fluids before meals. For obese patients or underweight clients, overweight clients, it is the opposite. Encourage taking more fluids before meals.